Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Today we have a 6 years old Labrador who has got a dental caries. There is a big cavity inside this carnassial, behind the carnassial tooth. This is a molar tooth, and this side we already rectified. Usually when this happens, it happens in both the sides. This side we are just now, we finished this dental filling, and this side we are starting. So I'll show you how we do this dental filling in Cessna. So if you will see, now we have already removed lots of stuff from inside. First I am doing the debridement with these dental instrument only. These are human dental instrument I just got from the some expo, dental expo in human. When they organize the expo, I usually go and I see lots of these stuffs which I buy and try to use in animals. And because we don't have too many specific things, and if I try to buy from outside India, they are very expensive. So somehow I try to manage it like this only. Now I am going to burr it with the diamond burr. Can we increase the speed of diamond burr and little? So whatever the dead tissue is there, I am just trying to remove it. And I need to remove it in such a way that my outer part should be little smaller. Inside I should make it a bigger cavity, so that my material stays inside nicely. So I am just making inside cavity little bigger, and I am outside I am just trying to keep as smaller as possible. If somebody wants to do this kind of procedure, probably they can ask their any friend who is a dentist. They can help initially to understand how they do, and then probably you can start, because sometimes the basic steps we may not follow, and we end up doing the lots of mistake, and these filling can come out within 3 to 5 days only sometimes if you are not doing properly. So you can see this that I am going inside, and from inside is little dome shape inside a little more, and I am trying to remove whatever the dead portion of the teeth is there, the material inside. So you can see the cavity, I kept it quite big inside. So if you will see here, this inside is a little extra deeper inside this area, so that my material should not come out, the composite material which we are going to use for this one. Now before we put the composite material, we put this universal adhesive. So I am just going to take one drop of universal adhesive. We can use a small, and I am just adding it everywhere. Probably I need to slightly dry it before I start. The surface should be completely dry. I also don't do very regularly, so sometimes I also miss the protocols, and that's why I'm telling initially, when if somebody is starting, they can take help from their some friend who is dentist, and that is always helpful. So I am just putting all over the surface to make sure the composite sits over this adhesive nicely. And now I am going to do the curing. So this is our curing light. You can do 40 seconds twice. That case is waiting for me. ठीक है, 10 seconds. You told them to wait for some. This is curing we have done now. This layer which we have put now got hardened completely. You can see the glistening surface. Now we are going to use our composite. This is our composite which we are using. Being it's a big cavity, I need to take a little extra composite, and in one piece only I need to put it inside. So center of this area usually we have to keep little more down, and we need to press it nicely, and you can see that, and this area has to be down. There is a groove here in this teeth. So what I am doing, I am just keeping my one specimen here, and I know that there is a depression in this area sometimes, because if you are doing these processes very regularly, you know, and I can't check in human we close the teeth and we find out whether they are touching each other because of the ET tube. I am not able to do that, and otherwise we need to put the ET tubes through this area, but that I am not doing right now. We are just managing without that. So I am just making sure that we try to keep that area completely down, this area like this, and we are keeping a depression here just like a natural teeth. Okay. Now again we are going to do the curing. I may be doing this process maybe 2-3 times in a year only. It's not a very common process for me also. So if you are learning also, you may not get like revenue and all, but it's an additional service you can provide to the clients, and sometime if you don't have any other options, you can use this. This composite sometime I use for other purposes also, for the bone, like if I am putting a small implant and all, I can use it as a hard bone of this. Sometime I use. Can we stop the water in the drill? So now what we are doing is we are just making the surfaces little equivalent area, all the surfaces. So I made the surface nice and smooth. For a little more smoothing, we are we can do that for no, it's broken teeth and all. It doesn't work in dogs because they can't take care of that very well. Cavity only you can fill up. Broken tooth because they'll hard substance they'll chew and it can break also. These are discs to make it more smoother. This is mainly for the polishing. Now we are going to put the adhesive this over this also. In human we don't put this adhesive after this, but I prefer to put one layer of adhesive and to make it more smoother, and whatever the small cracks are there, it will get filled with this and it will give a shiny smooth surface to this. Just make a layer and just even you can put on the normal area of the teeth also, just to make it more symmetrical. And then again we are doing the curing for 80 seconds. ठीक है डॉक्टर, I'll come डॉक्टर. We just keep them on 3 days of painkiller, no other antibiotic and all, nothing. We are not going to keep anything, just 3 days of painkiller medication, and we just wait and watch. I told the client that there is possibility that these fillings can come out, and you can see it's looking very nice, very hard. This can come out sometime, and then I given them option of removing the teeth also. So in case it comes out, we remove the teeth. You can see that this side also, this cavity we have done, and this side. So that's all about the dental filling. Thank you for watching video.